Hello, everyone. Thank you so much for having me speak to you. And I'm really excited to jump into this. What I will be reviewing for you is what is involved in a low vision evaluation and what are some of those tools and devices and resources that are available to the visually impaired. All right. In terms of financial disclosures, I do want you to know that I have no relationships or interests with any of the devices or services that I'll be discussing in this talk. One of the things that I realize when I give these types of talks is I might need to define what exactly is low vision. And I have a feeling that many of you in this room are hoping to never see me or a practitioner like me. But similar to what all the other speakers have said, we are a team and we're here to support you. So what exactly is low vision? So low vision is considered when we cannot correct your vision to the typical vision of 20/20 with glasses or contact lenses. So on the right-hand side of this slide, you'll see a high contrast visual acuity chart. And dependent on where you are from this chart, perhaps at the bottom here would be the equivalent of 20/20. Now, most insurance companies may consider a low vision diagnosis and perhaps coverage of a low vision exam at around when your best seen eye is 20/70 or poorer. And now I've indicated where that may land on this particular chart. So when your vision, even with glasses or contact lenses, is landing around here, you may find tools such as magnifiers or telescopes to be helpful in a day-to-day activity. So let's first talk about what is a low vision evaluation. And this is where I'm working really closely with the glaucoma specialist, Dr. Lin. We've had many co-managed patients together. And so what's involved in our exam is really three components. So the first one is looking really and talking to you for a long time. Where are you finding challenges in your day-to-day activities now that you've had vision changes? We do spend a good component of that really talking to you about what is your perspective of your vision changes. What have you experienced in your journey? And then we really dive into where are the challenges that you're having at school, at work, at home. Some of the things that patients will often describe is they're having difficulty now with cooking and cleaning. Where is that button on my dishwasher where I used to turn it on? Or where is the temperature dial on my stove? We also really want to involve your friends and family members and any caregivers as well, because we want to know the whole picture of where you're finding challenges. We also want to know what's happening outside of the home. How does it feel for you on a bright, sunny day, or maybe on a foggy day, like it often is here in the Bay Area? Curb and stairs are a big question that we always ask. Yes, in glaucoma, we're often thinking of that constricted visual field that you can encounter. But something else that is a big component of it is how your contrast sensitivity is. So I appreciate Dr. Lin mentioned it in his talk. Contrast sensitivity tells us where shadows are, and curbs and stairs are delineated by the shadows they cast. So in the upper right hand of this slide, there's actually a picture of a pretty serious set of stairs that it's really hard to tell where each step is. And that's because everything's just blending in with each other. How does driving feel for you? How does night driving feel for you? How does night vision feel? Are there things that we can help address in these exams? Once we've gotten through this first third of our exam, we're ready to do measurements of your vision that are different from your ophthalmologist and your optometrist. So I say we start with something different, but we do all measure visual acuity. So we have a high contrast visual acuity chart here, but we also want to know how is your night vision affected? So now on the right-hand side of the slide, I have an example of how we assess how your vision changes to light. So we utilize a set of darker filters that will remeasure your visual acuity and see how much it changes. In terms of contrast sensitivity, this is a test that some of you may not have done with your ophthalmologist or optometrist because there maybe wasn't enough time to do that in the exam. So on the right-hand side of the slide is an example of a contrast test that's actually covering up some of the words a bit. But what you can see is that it's a white background with the same size letters, but each letter is fainter than the one prior to it. So we can see how the object is starting to blend into its background. And what we know and what is being recognized in research is that contrast sensitivity has a profound impact on our day-to-day. It really is one of the #1 challenges I hear from all my patients, not just glaucoma patients. A great example of this is a photo on the bottom here. This is taken on a gray, foggy day in the San Francisco Bay Area. In the middle of our street in front of our house is actually a dark gray cat here, which most of us with typical vision may have difficulty seeing this cat blend perfectly into the background. So my 4-year-old daughter, Mari, at the time, had named this cat Lucky, because he was either real fast or we have really great drivers on our street. So he was there every day. All right, moving forward, also part of our exams is doing a refractive evaluation, but this will be different than your typical refraction. We don't use that machine that you pull up in front of the face, the phoropter. We use loose lenses. We use trial lenses. So those are done, an example at the bottom of the slide, and on the right-hand side is actually my mentor, Ian Bailey, showing an example of how the trial frame refraction works. And again, most of the time, a refraction may not, you probably have the right set of glasses on, but about 20% of our patients do just need a good refraction. But we work with our low vision patients in a way that assesses the vision functionally in a way that works well for them. In addition to the refraction, we're also assessing central vision, so that's on the left-hand side of the slide. This is more so in the cases of macular degeneration where we lose our center vision. We will also map out peripheral vision, which is, of course, very important in glaucoma, and we also do a reading assessment. Now, based on all of these measurements, all of this data we have, is lighting important? What level of magnification do we need? We can now look at low vision devices. So when we think about low vision devices and we think about what our patients are coming in talking to us about, oftentimes it's difficulty with reading. And if we have that 20/70 vision or that central vision loss, we want to magnify beyond that central vision loss. So these devices and the resources that we now introduce to our patients is really individual to the person and to their task. So there could be a number of devices that could work. We always want to start with optical systems first. So in terms of distance devices, so distance spotting devices, first and foremost, having a good pair of glasses on, but then secondly, looking at a monocular telescope. So this is one half of a binoculars, which we're all familiar with, and this is going to be great in situations of reading menus behind a counter that we can't physically get closer to it, artwork, airport departure signs, things like that. These are intended for quick spotting activities. We can also mount a monocular telescope into a pair of glasses, thereby creating a bi-optic system. And then this picture here at the bottom, which I then magnified for us, has a picture of a telescope that is mounted into the pair of glasses. So ideally it's out of the way, but if needed, you could tilt your head down and sight through it, but then most of the time you have your good field of view. And that's the thing to keep in mind, is that we're magnifying, but when we magnify through an optical system, we have now decreased the field of view, which may not be something we want to do in glaucoma. Another image here that I have up is called the Max TV glasses. This is by, many of you may have tried it. It's through a company called Eschenbach. These are basically telescopic systems that you're wearing on your face here. But if we really focus in and think about glaucoma and our constricted visual fields, these magnification telescopes can be used as a field expander if we consider them in the inverse orientation. So if we take a 4 times telescope, use it traditionally, everything's magnified 4 times. You flip it in the opposite orientation, and now you have something that's minified by 4 times, but the field of view has expanded by 4 times. So to attempt to give you an example of this again is a picture of me and my daughter at the time, and perhaps we can see that we have both of our faces here, but in the case of, let's say, severe glaucoma, the field of view has now constricted so much so that we can only see parts of my face and parts of hers. We then take the telescope in the inverse orientation, and you can see that we are much smaller, we are minified, but you can see more of us. So this is an attempt for me to show you what this could potentially look like. Again, this isn't something that our patients are walking around wearing full time. This would be something that perhaps you enter a crowded hallway, you're unfamiliar with it, you hold the telescope in its inverse orientation, and now you can say, oh, there's a plant on my right-hand side, a water fountain on my left, and now I can navigate down this hallway a little bit more safely. All right, so that's our distance devices. Let me talk a little bit about systems for reading. So we will start with optical systems. Those are a little bit more approachable initially. Reading glasses, and we can go much stronger than the reading glasses that a lot of your optometrists and ophthalmologists may feel comfortable prescribing. I think many of you are used to the terminology of a 2.0 or a 2.5 pair of readers. We can go really strong. We can go up to 80 if needed. One of my colleagues does like that really strong reading pair. One of the things, though, to keep in mind is the laws of physics. So those properties are, the stronger you make the magnification, the closer you have to hold it to keep it focused. So not a lot of us want to hold our reading material right up to our eyes, so we can instead of having strong reading glasses, you can hold it a little bit farther away and use a handheld magnifier or a pocket magnifier. Perhaps you don't want to hold it up for that focal point. Have it stand flat on the page, and now you have a stand magnifier. One of the things to keep in mind is these options that there's pictures up here on the slide with it, they can come with lights embedded in the system. So now if we're saying your contrast sensitivity is affecting how well you can read, try to make it brighter, there's already lights embedded in these systems. Well, a lot of us are using our phones. Many of us are using our phones right now. Can we use our phones as a magnification device? Absolutely. A lot of you are taking pictures and blowing them up right now. There are apps on the phone, and these three that I've listed here are ones that many of my patients say they enjoy using. TapTapSee, Seeing AI, and Be My Eyes. If you're not familiar with these apps already, a lot of them are utilizing the camera or the photos within the app, and then it will auditorily describe it to you. Or it'll use Seeing AI to kind of explain it to you as a live picture. Be My Eyes, you can activate it to have a live person to help you. So one of my patients said that they used Be My Eyes because they weren't sure where the outlet was in the hotel room, so they were able to hold it up, or a manufacturer warranty for their new television. So these are things that you can utilize already in your pocket. What if you don't want to use your phone? What if you want a standalone magnifier that isn't optical, let's say an electronic magnifier? These are video magnifiers. They use closed-circuit television technology, so that's why we sometimes refer to them as CCTVs. The image on the far left-hand side is an example of a desktop version of a CCTV, so maybe about the size of a computer screen. These all have cameras underneath them, and it'll take your newsprint, let's say, gray-on-gray information, magnify it to your preferred size, but also change the contrast. So we can now take that newsprint and make it white on black, black on yellow, whatever works best for your vision. What's nice about this technology is that it can also employ optical character recognition, meaning it can do text-to-speech. So we can start to train those other systems that Jordan was referring to. Can we start to train our auditory reading in addition to having visually magnified for us? So that's a really nice option of these. On the far right-hand side is another device made by the company Eschenbach called Optaro. This is essentially turning your own iPhone into a portable video magnifier. So it has a stand with a secondary camera to it. So again, using the tools that you already have. Well, what if you wanted to put these CCTVs on your face? What if you wanted a hands-free option of this? Sure thing, you can do it this way. So these are what we're moving into called wearable devices. The images that I've pulled from here are from a really great YouTube channel called The Blind Life. This is a great resource if you're looking to see what kind of low vision community is out there or whatever devices and things that they would review. So the first one here is called the Patriot Viewpoint. This is very similar to the Iris Vision, which some of you may have already tried. This is using a Samsung phone. So this comes with the device if you purchase it from the company. And it also has essentially gamer technology, from what I understand. So if you're doing virtual reality gaming, you wear this head-mounted device. This is similar to it. So the Samsung phone has the apps that you need already on it, and now you can wear this device to utilize it as a video magnifier if you're looking at printed material, or you can stream in what you're trying to see as well. Most recently, there's a version of it for your iPhone called the Maggie IVR, and this one you don't have to have a separate phone for this. You can use your own iPhone, is my understanding. Everybody, though, is asking us in the low vision community, what about meta glasses? Meta glasses are going to make everything better for me. So I'm going to talk a little bit about this, and then also talk a little bit about EchoVision, which is the low vision company that is looking to utilize some of the same platforms. So I think most of us are familiar with what meta glasses are doing. I think the main thing you have to think about is, what do you want these glasses to do? Do you want them to read for you? Do you want them to magnify for you? Or do you want an AI smart speaker? Which is essentially my understanding of what meta glasses are looking at. These were developed for the consumer market. So this is something that is available to everyone, and the low vision community has partially embraced it. With that knowledge there, one of the other benefits is that it is lesser cost compared to the EchoVision, but again, price points on technology always change. But one of the things to know about Meta to keep in mind is that it's all auditory. So if you want the glasses to read something for you, you have to ask it verbally. So if you want it to read a menu, if you want it to read a street sign, if you want it to read a recipe, you have to say it to get it to do it for you. And then it Bluetooth, or it connects into a speaker near your ear. So if you're in a quiet environment, let's say a waiting room or something like that, you may not want to ask it to do something. Because of privacy protections, you can't use meta glasses to describe faces or people. So that's not something it'll do for you. And one of the things one of my patients told me that was a disadvantage is that you can't use it while it's charging. So it's only when it has its battery life going. EchoVision is a low vision company that's using similar technology to the Meta glasses. So it has the same as a similar type of frame with the camera involved in it. But it is really geared to the low vision community. So you can have it actively always doing optical character recognition or text-to-speech for you. So you don't have to direct it to read a menu. It'll just start doing it. You can activate the AI component as well. But a benefit, which my patients have told me to it, is that you don't have to voice activate it. There's a touchpad on the side. So you can magnify by using the touchpad, tap it, it'll do the changes that you need. Because it's a low vision device, it can describe people or faces. You can store images of people that you know so that the glasses will let you know this person's coming up towards you. A benefit that they talked about is that you can use it while it's charging if needed. It is more expensive. I believe right now they're taking pre-orders for it. So my patients that have been beta testers for it, they really liked it. So we'll see when it comes out. I understand it's also more expensive and has a subscription format to it. Okay, let me move into the last component of my talk here, which is what are those resources? And again, I'm so thankful to Jordan. She really described a lot of the resources that I'm going to dive into. But a lot of it, again, is supporting this community that's here for you. It's community support and things that can make you start to feel more confident and regain that independence. A lot of this is going to be through nonprofit organizations in your area. So most of these nonprofit organizations, first and foremost, are going to talk about what Jordan talked about, having support groups, whether it's virtual or in person, offering counseling, whether it's one-on-one, but not only for you, but your family members and the other people that are around you to kind of go with you through this journey. Many of these nonprofit organizations are going to offer training classes in relearning those independent living skills. Now that your vision has changed, how does it feel to be cooking and cleaning? How do I navigate this now? These could be drop-in classes or immersive programs where you're somewhere for a week, a month, or other organizations can do it even for longer. But again, it's really bringing together the community and the support. And while oftentimes if we're thinking in glaucoma, perhaps it's an older patient population, but it's offered for all age groups. So remembering that the little ones, the teenagers, the young adults too. Oftentimes, too, the nonprofit organizations will make a discussion of orientation and mobility, O&M. So this is really how do you learn how to navigate independently when you're in new environments. So these specialists, these certified instructors, are first going to talk you through the orientation part of it. And this is, the onus is on you as the person learning it. Where are you in geographic space? Do you know how to turn right and left? Do you know your route to the library? Mobility is how do you get there safely? What are the tools that can be introduced? And oftentimes this is a long white cane, right? So if it's the drop-offs and the curbs and stairs we're worried about, the idea is to have something in front of you that will detect those drop-offs before you do. We don't want to have a fall. A guide dog is a mobility device as well, too. And again, that's something that can be helpful when we think about, a lot of people want to jump straight to the guide dog, but the guide dog's not going to know how to get you to the library. You have to be the one who knows those routes. In addition to this, we can also think about most of these nonprofits are also doing technology training. So everything I already discussed, whether it's an optical system like a magnifier or telescope, they will train you on that, as well as doing training on your smartphones, utilizing it the way that it could be. In addition to that, your computer systems, your laptops or desktops, electronic magnification, the wearable devices we already discussed, and also software that you can use on your computer that not only magnifies, but it can also speak to you, like an auditory option, so that you can use those other resources and senses that you have. Here, I apologize, I have narrowed it down very quickly to the Bay Area here in terms of what are these rehabilitation agencies. There's quite a long list on the left-hand side, but I encourage you, for those of you who are not from the Bay Area, to consider reaching out to the organizations in your own state. The one that I have listed here, at least for California, is the California Agencies for the Blind and Visually Impaired, but they will also have links to other states. You can also reach out to the American Foundation for the Blind. There's resources there. Don't forget about vocational resources. So in California, it's called the Department of Rehabilitation. The goal of these vocational agencies is to support anyone of working age. So this is something, again, they can help you with resources. They can help you with low vision exams, devices, and training. You're also very welcome to reach out to me as well. I'd be happy to connect you with individuals that I know in your specific state. So. Thank you very much.